I'm Dr. Mustefa Negash from Ethiopia, from Addis Ababa, capital city of Ethiopia. I'm a gynecologist obstetrician and fellowship in fertility and endocrinology in the country. And I'm the first fertility and endocrine care training currently. Merck Fertility Training program is very helpful for me, and I had some short course trainings in fertility care in other places, but this center is very intensive, very organized, structured with all the simulators, and I learned from this center how the setup is typical IVF center is well organized, the administrative flow and the laboratories, the clinical care and the patient flow, and from counseling to up to the patient discharge from the hospital. And I have learned this organization from this center. Coming to the clinical exposure, there is also a well-structured lectures going on by well-known fertility providers here in the center. And they have also a very long experience, and they have their own fellows, and they have experience, and we have a lecture, we have a simulation which we can exercise in all clinical care areas in fertility. All simulations are there, the ultrasound, the ovum pickup, the hysteroscopies, and the embryo transfer. All these things are there for according to the level of difficulties and the challenges, and we have also ample patients for exposure and in all areas, and this will help me a lot in organizing my center when going back, and providing structured, well-organized care for my patients. My immediate plan is as much as possible. I have to exercise what I have gained from here. So to do that, I have all the resources. I have all the resources. We have started just IVF care in one of the public hospital, and in return I will recruit my patients, I will evaluate them, I will follow them, and I will treat up to pick up and the transfer, and I will also see the organization of my center in relation to this center, to the standard care. And we have also both operative and diagnostic hysteroscope, laparoscope, and we are doing already that. So after going back, this is a very right time, very, very appropriate time for me to utilize my skills and knowledge I have gained from this center. In my stay here, the areas I have exposed is in patient, from patient entry to patient exit. From patient entry to the hospital, I have exposed to different types of patients with different cares, different types of service needs of the patients, and we have clerked, we have evaluated, and to the ultrasound. From the ultrasound, we have seen all types of lesions, normal types, variants, anomalies, and pregnancies. And with ultrasound, we have follicular monitoring, and drug treatments, monitoring regimens, and which protocols, which patient fits which protocols, and which one is appropriate for which particular patient, and also counseling, intensive counseling by providers at OPD and outpatient department, and intensive counseling, group counseling, I have seen, we have seen that also, and the different endometrial preparation protocols for donor cycles, for self cycles, and coming to the procedure rooms, we have observed and have done some pickups, how the techniques or proper techniques of approaching the stimulated ovaries, triggered follicles, and how to pick up systematic way of picking, operating on the patient, and how to maximize your operation techniques, and also patient selection, patient preparation for operation, pre-anesthesia care, and also patient for hysteroscopy, laparoscopy, cerclage, and endometrial preparation for transfers like platelet-rich plasma injection to the endometrium, and also granulocyte colony stimulating factor provision, different treatments provisions we have seen, and also the embryo transfers, and escorting the patient from the pickup to the recovery room, how to discharge, what complications we should anticipate, what complications we should cover, we should watch, what danger signs we should tell the patient, how to monitor them. And we have seen also few OHSS, mild ones and moderate ones, and the evaluation. In the ultrasound, we have also seen the congenital anomaly screening, first trimester screening, and endo first trimester screening of the intrauterine pregnancies, the protocols for doing cerclage. And also in the meantime, we are doing exercise on simulations. And it was very intensive, and we have covered a lot of, I have covered a lot of areas. I would like to thank Merck Foundation Training Program in providing this crucial training for unreached women of developing countries, underserved countries, especially Africa, and low economic status of Asia. And it is nobody has realized infertility as a problem in these developing nations, because overpopulation and fertility is said to be the major problem. But equally, the psychosocial and physical traumas made to these childless women are tremendous, and it is hidden. So Merck Foundation, in complementing the healthcare service of these couples, is timely, and I think it will fill the gap of providing full reproductive health coverage for women in unreached communities like underdeveloped or developing nations. And I would like to thank again Merck Foundation for its unreserved support in training and other material support for in these countries and my center.